widespread implications in the province, what this means for the next phase of reopening, what people are saying in the region itself, and how the province is responding. Let us speak in greater detail with the scientist that Harry was just referencing, New Brunswick's Chief Medical Officer of Health, Dr. Jennifer Russell. She is in Fredericton as well this morning. And Dr. Russell, we really appreciate that you've cleared some time for us today. Thank you for being my guest.
You're welcome, Heather.
I know you were listening to Harry's reporting there. So Harry had what we thought was the most up-to-date information. Our colleagues at Radio-Canada giving those details, the 6 cases so far, 2 of those patients in intensive care in hospital. Has anything changed, the knowledge that you have, the numbers that you're working with to this point?
Well, this is a rapidly evolving situation, and we have our public health teams and the regional health authority people working very, very hard to get all the information they need. And just to backtrack a little bit, I know that you've indicated in reporting, and we have given some information around the details of the situation, but I think we need to reserve judgment until the entire investigation is complete and try to be as compassionate as we can at this point in time to facilitate ongoing investigation and to facilitate cooperation and understanding with the people involved in the situation.
Okay, I appreciate that, because we've already heard from people in New Brunswick speaking to CBC reporters very angry at what has happened as a result of this situation. So it's a good call for calm as you proceed. But can we just verify the numbers? It is 6 cases that you're talking about confirmed so far.
Yes.
And the Premier Higgs was saying that to Vashi yesterday that it's at least 150 people potentially exposed, but could be very many more. Have you revised your figures this morning at all?
I don't have new figures at this point in time, but the information yesterday around the 150 is accurate. And again, that's just the first round of contact tracing. So as each new case is diagnosed, there's another round of contact tracing. And as you know, there are 2 healthcare providers in that group of 6 cases. And so the contact tracing is not complete with that set of positive test results. And as new positive test results come in, there will be more contact tracing around that. So this can be very widespread. As you know, there can be an exponential rise in the number of cases very quickly in this type of situation.
And 2 of those cases are in intensive care. Do you know if they're on ventilators at this point?
All I know about the situation of the folks in intensive care is that they're stable at the moment.
Okay, that's good news. The Premier was telling Vashi that yes, you have been prepared, and we've certainly seen New Brunswick's state of readiness for all of this. And so you've deployed the rapid testing. Can you tell us exactly how you are responding in and around Campbellton now to figure out just the extent of how many people have been exposed?
Well, again, the contact tracing is happening and the rapid testing is happening, and this is something that we have prepared for. We've done 2 kind of dry runs. We did an actual rapid testing exercise, and we have also done some tabletop exercises. So all the players needed to mobilize in a quick turnaround time have been all deployed to the region. So we do expect to do much more testing in the next few days. Obviously, we want to test the immediate contacts, close contacts of cases in this first round, and then asymptomatic people would come in the next round. So, but over the course of the next 4 to 5 days, we'll be doing a lot of testing.
You were ready for this in case, even though the indications and the trend lines were working so much in your favor. But you did say yesterday at the briefing that this was completely preventable in spite of all of our efforts to keep the virus at bay. I'm wondering a couple of things. I'm wondering about the circumstances you were in and where you were when you heard about this, that it was a doctor who traveled out of province, who came back into the province, who didn't follow the rules that you had set up, and then this has been the consequence. Can you just give us a little bit of a behind-the-scenes perspective on your reaction, the circumstances as you learned of this?
Well, I guess I want to go back to the wording that I used in my speech yesterday. I don't actually think this was completely preventable in the sense that there are a lot of uncertainties around this virus in terms of how it behaves and how human behaviors contribute to the risks around how it's transmitted. So that's number one, is I don't actually think any cluster of cases is completely preventable in the sense that as long as there's a pandemic, globally, as long as there are cases outside of our province that can be imported to New Brunswick, I don't think this is something that is entirely preventable, but with respect to the scale and the scope and the magnitude, I think that's the unfortunate part around the situation, and the fact that there are healthcare workers involved, and it's impacting the healthcare facility in terms of it being able to offer services at the moment. And so having to redirect patient care, having to redirect those services is a big challenge at the moment. But again, we are working very, very closely with the Regional Health Authority of Vitalité to mitigate all of these things right now. But it is, again, it's a huge concern. It's obviously disappointing and challenging at the same time, and we will do our best to stay on top of it as much as we can, and again implore that the public continues to cooperate and be patient and understanding around the work that we have to do and what they can do to contribute to helping in this situation.
I'm wondering, so this was a violation of the guidelines, the rules in the province, not to go into self-isolation for those 2 weeks for a healthcare worker. But are you aware of what protocols at all might have been in place at the hospital where he then, where he was treating patients? Because from hospitals elsewhere, as I understand it, there are processes in place where everyone and healthcare workers who arrive at the hospital, entering the hospital, they're asked about potential exposure to COVID-19. They're asked, have you traveled outside the province? What did the hospital have in place, or did it have, in fact, proper, questions and guidelines and screening in place?
Well, as Premier Higgs said yesterday, this is a human resources issue that is being looked into in terms of all the details. But in a general sense, yes, all the hospitals do have screening and protocols, and they do have rules around self-isolation, etc. But again, to highlight the fact that we aren't an island, our borders are not completely closed, so there is essential travel happening every single day. People coming in to the province who there are certain types of exemptions that can exist. So this is an unfortunate situation, but the risk of something like this happening, perhaps again not on this magnitude, has always been there from the outset. Again, because we have to keep our borders open for essential travel and essential goods and services to be able to be provided.
You've certainly called for compassion here in the circumstances. You're not identifying the doctor for reasons of protecting everything around him, his identity and security, as the Premier made clear. But information has gone to the RCMP for investigation. What is your perspective on whether, the doctor has already been suspended, we know now. Are charges appropriate here?
Well, again, I would leave that to the authorities who are looking into all of this. And as I said before, it is a human resources issue. And again, whatever investigation has to take place, I would just let those people involved do their work and wait for the outcome to see what unfolds. But again, we want people to be aware that as long as COVID-19 exists on the planet, and until there's a vaccine, that we really do have to understand that it will be challenging no matter what. So that's why it's really important for everyone to do the things that public health is directing them to do as much as possible. Follow all of the social distancing advice, wearing the masks, the community masks when you can't socially distance. Really limit your close contact with others. There are many things that people can do to stay safe. And encouraging people. Mental health is a really huge problem as well in terms of, I think there's a lot of anxiety in that community right now and probably elsewhere in the province, as well as among healthcare workers. I think from the very beginning of this, whenever we would see social media stories and images, we saw the trauma that healthcare workers were undergoing dealing with the situation and the stress. And so the Canadian Psychological Association does have pro bono services for frontline workers. And I would encourage all frontline workers to reach out and get that help. And the New Brunswick Medical Society also offers free services to physicians.
There are very important lessons to derive from this, as you've just laid out, that we can all look to as we move through reopening and still need to be reminded of the presence and the threat that still exists. I'm wondering if this turns to be a worst-case scenario. As you said, you're rapid testing now for at least 150 people, and as you've said and the Premier said, it could be many more. If it is far more, and there are massive hospitalizations, how prepared are you to deal with what could be a very significant outbreak?
Well, the good news and a bad news story is that the preparation that we have done since the beginning included doing modeling of what types of worst case scenarios, including situations that could have happened in places like Italy, if that type of situation were to happen here. We have done such extensive work planning around how many hospital beds do we have, how many ICU beds do we have, how many ventilators do we have. And when we did our projections, we were very confident that if we did have a very significant event, that we were going to be able to manage it at that time. But as you know, there are some things that are unpredictable. But with the things that we were able to model and try to plan for, we were confident early on that if we did have significant hospitalizations, et cetera, that we would be able to manage. But I think you can never quite, a model is a model, and it's based on predictions, but those predictions obviously can change based on the reality of the situation and the data that we have today.
Okay.
So as the situation unfolds, we will be obviously watching for all of the things that we need to do in that situation if we need to really mobilize and make sure that we have all the hospital beds, et cetera, that we need to be able to utilize.
Dr. Russell, just stay with me for one moment. I just want to explain to people in the bottom corner of the screen, you can see Canada's Transport Minister, Marc Garneau, who's getting ready to join a news conference virtually. We're also waiting for Mark Miller, and we will take this news briefing live just as soon as we can, but I do want to finish with Dr. Russell. On this note, I think, and you've obviously impressed upon me the sensitivity of the situation and how much this is going to hurt so many people in New Brunswick, because you were poised today to reopen more, and the province had been doing so well, and this is a big setback. And as I said to you, New Brunswickers have already expressed their disappointment and their anger. I'm wondering about your personal disappointment, if at all. We've been watching your briefings. We've seen Premier Higgs' approval ratings have been so high. You've led those briefings such a competent manner, and people in New Brunswick have been so well served by your planning, and they have reflected that as they've answered polls, for example. A fellow doctor creates a major challenge for your province by not following the rules that you have set out. And I'm wondering just what your personal reflections are on this.
Well, again, from the planning perspective and the risks and setting expectations, we were trying to be careful about letting the public know that, yes, we're doing well now, but that could change at any time. And obviously having healthcare workers involved, whether it was because they broke the rules or didn't break the rules, is unfortunate. And the impact, because healthcare workers involved, again, we will see widespread impacts of this. So the challenge is there. It's been there from the outset, from day one of learning about what the impacts of a pandemic globally can mean to our province. So I agree that it's challenging, but I think from the onset, from the beginning, we really needed to manage people's expectations around what worst case scenarios could look like, and whether or not we could all be prepared for that psychologically and from an operational perspective. So I made peace with this at the beginning, that these types of things could happen, and that they would be very unfortunate and very challenging on an emotional level for every single person in this province who will be touched by this situation.
Dr. Russell, as I said, I appreciate your giving us so much time today and your insight into all of this. We'll certainly be keeping in touch with you today and in the foreseeable future as you deal with this. And again, thanks very much for everything this morning.
Thank you, Heather.
Dr. Jennifer Russell is New Brunswick's Chief Medical Officer of Health.